is going to be hazy through Friday, as you mentioned. So joining us now to explain more about the Saharan dust and how it impacts our health is pulmonologist at UTHealth Houston, Dr. Bindu Akkanti. Good morning. Thanks for coming in.
Good morning. Thank you for having me.
So you're laughing at our allergy suffering over here because you know that's what people are going to be feeling for the next couple days.
If you love Houston, it's one of those things that comes with
every year.
I know.
It does feel like it's gotten worse in recent years, like maybe the plumes have been bigger or maybe because of a lack of rain or something, but it feels like we're feeling it more.
And I think since COVID, people are paying attention to their lungs.
Oh, maybe that's
a really good point.
Yeah.
That, when you go out and you have the sniffles, you're like, is this COVID? Is this the sniffles, or is it the Saharan dust coming in? So you never know.
Does it lead to any kind of complications? Like, is this dust something that people need to be concerned about?
I think for the normal average patient, probably not. But if you have lung disease or heart disease, and especially people with allergies, it is going to make your day a little rough. I think those are the three groups of people that I would like to really focus on. Listening to your body, making sure that you have all your inhalers, taking them regularly, listening to the doctors that are taking care of you. I think that is something that comes naturally to patients on a daily basis, but especially when these storms come in and you don't know if it's going to last 1 day, 2 days, or an entire week. I think that's really important to pay attention to the weather.
Yeah. And is it something too, Doc, that where, if you don't necessarily have the sneezes or the irritated throat or this and that, but if it's more of a sinus issue, right up here in the front part, right? Because I can feel it right now.
Me too.
It's like a little bit of a pull at that point. Can that be related to it as well?
Absolutely. Okay. I mean, allergies are, the dust particles are very tiny microns, and usually your nasal passages are supposed to just get rid of it, right? So, but when it goes inside the lungs, that's when it elicits this allergic response that may be a little bit more severe than your average, and especially this is more topical, so something like an inhaled corticosteroid that is over the counter. But if it's more serious, then definitely going to your physician does help.
Well, Dr. Akkanti, I feel like we all, now that we're feeling it, now we're taking the medication. We weren't doing anything to prevent it. Everything's been retroactive. So, I mean, is that good enough? Can we get on top of our symptoms now?
I think from the allergy standpoint, being in Houston, it could be as simple as just keeping a note on your phone. Like, on every month, I have about 3 to 4 allergy days. And that may not be a serious issue, but if your quality of life suffers, it may be worthwhile to go on something. And that could be just an as needed medication, just for instance.
Like an over-the-counter stuff.
Over-the-counter stuff. Okay. But if it is impacting, and this is like an ongoing issue, a maintenance medication does help, whether it is over-the-counter or something that your doctor prescribed. Absolutely.
But we have you here too, because the people who are going to be really badly affected by this are people with lung conditions.
Absolutely.
You mentioned asthma.
Yes.
Are you concerned about those patients?
Yes. Asthma, COPD, any kind of patient that has maybe low level of lung fibrosis or actual lung diseases, and patients with heart disease as well. There is some link to pollution and the effects of pollution on your overall cardiovascular health as well. These patients, I think, sometimes when there are no symptoms, you can kind of get back and go, oh, I'm doing okay. Yeah. And then you go out, and it may not be a day where you're exerting yourself too much. So in this particular condition where, for instance, the dust storm is coming, it may not take much for them to get exhausted.
It'll over account for that.
To get exhausted. So those are the patients that should make sure that they're adequately hydrated. They know their limits in terms of how much they should really push themselves. And most importantly, take your regular medications.
Very important. Well, and it's interesting too, because we've got a scenario where you've got an area of high pressure in the higher part of the atmosphere. And I always like to use the analogy of take a bowl and turn it upside down. And so things can't get anywhere. So as you were saying, Doc, you've got the ozone, particulates, pollen, spores, everything is kind of trapped close to the surface here. And if you take and you're just stirring it up when the sun comes up and then you add the dust to it, it can overwhelm if you're just a usual taker of maybe 1 or 2 days.
Absolutely. And it's also important to keep in mind about our children as they go back to school as well, right? In terms of their health as well.
Dr. Bindu Akkanti, we thank you so much for joining us in studio this morning. That was great information.
Thank you so much for having me.
Yeah, thank you.